Hello, everyone. Good to see your smiling faces once again. My name is Richard Knight, President of the American Association of Kidney Patients, and I have the distinct pleasure of introducing our next speaker, Dr. Rodgers. Since 2007, Dr. Rodgers has served as the Director of the National Institute of Diabetes, Digestive, and Kidney Diseases, NIDDK for short. Dr. Rodgers provides scientific leadership and manages staff of more than 630 employees and a budget well over $2 billion. As a research investigator, Dr. Rodgers is widely recognized for his contributions to the development of the first effective and now FDA approved therapy for sickle cell anemia and was a principal investigator in clinical trials to develop therapy for patients with sickle cell disease. During the past 6 months, Dr. Rodgers has focused the agency's resources, knowledge, and expertise to help everyone affected by this pandemic caused by COVID-19. The people at NIDDK are engaged in research to better understand, treat, and stop COVID-19. NIDDK also is supporting COVID-19 related research through grant funding. Now, I have the pleasure of working on Dr. Rodgers' NIDDK Advisory Council. Again, the concept of patient engagement in play here. I am one of the few patients, if not the only one, to serve in this capacity. In closing, I should add that Dr. Rodgers, a doctor and a leader, and myself, a humble patient, have at least one thing in common. We are both recipients of the ASN President's Medal, awarded by the American Society of Nephrology. Paul Conway and I received this award in 2017, and Dr. Rodgers was awarded the same medal in 2018. This medal is awarded to individuals who have helped advance ASN's mission to lead the fight against kidney disease by educating health professionals, sharing new knowledge, advancing research, and advocating the highest quality of care for patients. Ladies and gentlemen, I give you Dr. Rodgers.
To my friends at George Washington University and to the AAKP, thank you for this invitation to present at the AAKP Global Summit. My name is Dr. Griffin Rodgers, and I'm the director of the National Institute of Diabetes, Digestive, and Kidney Diseases. And in the time allotted, I'd like to share with you how innovation and community engagement furthers kidney disease research at the NIDDK. I'm pleased to join our friends at the American Association for Kidney Patients for this important global summit. And I'd like to acknowledge the important role and work by Richard Knight and Paul Conway at AAKP and thank them for their leadership in advancing kidney disease research. So what you'll be hearing about in the time allotted is something old and something new. NIDDK has a host of scientifically unique and clinically important projects. I'll be recapping a few ongoing projects that you've heard about last year, but also tell you about some brand new ones as well. NIH and NIDDK is starting the Human Kidney Precision Medicine Project with the goal of understanding human kidney disease sufficiently to answer three important questions. What do I have? What will happen to me? And what can I do about it? This ambitious project requires a new approach, not just medical records and blood and urine samples, but kidney biopsies. The KPMP mantra is patient first, safety first. We have consulted ethicists, work with patient participants. We will ethically and safely obtain and evaluate human kidney biopsies from research participants with both CKD and AKIs. These analyses will generate data to find disease pathways and key cells, define disease subgroups, devise individualized treatments, and improve the scientific knowledge base, thereby improving the drug development pipeline. With these data in hand, the KPNP aims to set up a new kidney tissue atlas that will become the reference Bible of the pathology of future, answering those three fundamental patient-centered questions. One of the unique parts of KPNP is that patients have been involved from the very beginning, not just as research subjects, but as true participants in the research process. They go to meetings, they ask questions, they push the investigators to stay on track, and now helping to write the consent documents. Patients will continue to play a critical role in KPNP, as well as address challenges such as insurance coverage for complications. They will be our ambassadors as we move forward from the design to the implementation phase in about 6 to 9 months. Richard Knight serves as a co-chair of KPMP's Community Engagement Working Group, and Paul Conway serves on the KPMP External Evaluation Panel and has been instrumental in developing KPNP's communication plan. We are most grateful for their leadership. Variants in a gene called APOL1 were shown to account for much of the noted 2 to 4-fold increase in kidney failure in African Americans compared to whites. Evidence also shows that those who receive a kidney transplant from an individual with 2 APOL1 variants are at increased risk of kidney transplant failure, irrespective of their own race. Moreover, the potential risk for living individuals with 2 APOL1 risk variants who donate a kidney remains unclear. The NIH-sponsored Apollo study was accordingly designed to comprehensively assess the effects of APOL1 variants on the risk of kidney transplant failure across all transplant centers in the U.S. Apollo will also study the impact of APOL1 variants on the health of living kidney donors. Results will be crucial to fully inform needed policies regarding living kidney donations from African Americans and the allocation of kidneys for transplantation. This slide describes a project that we're supporting called COPE AKI. That stands for Caring for Outpatients After Acute Kidney Injury. The goal of this project is to develop and test interventions to reduce the morbidity in AKI survivors. Potential interventions include risk factor mitigations, such as blood pressure controls, care bundles that address fragmented care, poor communications among providers, and other barriers to care, and will use efforts like telemedicine and remote monitoring apps, as well as strategies, both pharmaceutical and non-pharmaceutical, to improve recovery or prevent recurrent AKI. Fostering disruptive innovations is really another way to advance nephrology. And as you can see from this slide, there are a set of both individual or institutional network awards, innovative science accelerating programs, as well as the Kidney Precision Medicine Project and the very innovative Rebuilding the Kidney efforts, as well as others designed to provide this disruptive innovations. NIDDK just released a funding opportunity announcement supporting our new approach to training the next generation of kidney researchers. The Institutional Network Awards will be designed to cultivate a highly integrated community of trainees and resources to propel KUH training and research. To foster a true community of interdisciplinary trainees, only one application per institution is allowed. A single consolidated application from several institutions within the same metropolitan area are encouraged. We're also in the process of planning a couple of exciting workshops that will be held in 2021. In the spring, we will hold a workshop on improving home dialysis to identify research questions that could address knowledge gaps to improve wider adoption and improve patient experience of home dialysis therapies. And we're also planning a workshop for next summer to stimulate research and technology development that could lead to improved access to kidney transplantation. During NIDDK's last advisory council meeting, which was held remotely, we asked the council for their insights on the scope of the current COVID-19 impact on NIDDK's supported research, from basic science to translation and clinical science to training and career development, and on how NIDDK can assist in restarting research activities. Many issues were considered, such as increased costs for conducting research safely in the current institutional environments, the loss of revenue to support research at academic institutions, particularly those that are hospital-based, and the disproportionate effect of the pandemic on investigators with school-age children, on young investigators, and on investigators who are a part of underrepresented minority groups in this country. Our counselors also highlighted challenges to the very conduct of scientific research, such as the accommodations that need to be made for the safety of all involved, fear or reluctance on the part of participants in clinical trials, and the inability to collect outcomes data and biosamples. When it came to ideas on how to mitigate these impacts and the role of NIDDK and NIH, three common themes emerged. They were policy flexibility, policy accommodations, and targeted investments. Council members provided a number of suggestions along these lines for our considerations. And many of these issues and challenges raised are not unique to NIDDK. NIH has been working hard to get in front of these issues that the pandemic has created for the research community. And several recommendations made by our council members have been addressed by NIH at a trans-NIH level. For example, NIH has provided flexibility in human subjects project extensions and in managing project costs. However, NIDDK will do what we can so that researchers can continue the important work needed to address the root biological, social, and economic causes of chronic disease and to develop ways to combat these conditions. And importantly, I want to highlight NIDDK's commitment to understanding health disparities that have contributed to the racial inequities that have been highlighted by recent events. This will be an important part of our strategic plan and also important and an ongoing part of our research program to understand the causes of the health disparities for diseases within our mission, including how these diseases may be contributing to the COVID-19 disparities. And specifically addressing COVID-19, we have been engaged and are greatly interested in understanding mechanistic study of the interactions between the SARS-CoV-2 virus and diseases and organ systems of interest to NIDDK, particularly those that include kidney disease, urologic disease, and obviously diabetes and some of the other diseases that we're responsible for. Along these lines of the strategic plan, this really brings me to the final portion of my talk, and I'd like to take this opportunity to mention another major effort that NIDDK is undertaking, a 5-year strategic plan for the Institute. And along these lines, I'd like to give another shout out to Richard Knight for his participation and leadership of one of the important aspects of this strategic plan. As you may know, Congress mandated in the 21st Century Cures Act that every NIH institute develop its institute strategic plan. Now, while NIDDK has previously focused on our disease-specific strategic planning, we're taking this opportunity to develop an overarching plan for the Institute. This plan will complement our disease-specific planning efforts and will be a 5-year plan to present a broad vision for the future and to demonstrate the value of NIDDK's research now and going forward. Importantly, we view this as an opportunity to gain insight from leading researchers and patient advocates across NIDDK's mission. So, as a part of this strategic planning process, we were asking for your valuable input on this plan from the research and patient communities and others who have an interest in the research within the mission of NIDDK. A request for information or an RFI has been released. There's still a few days to respond. The RFI closes on July the 31st, so we invite all of you to submit your ideas. Links to the RFI are posted on the NIH Guide, on the Federal Registry, and on the NIDDK's website. I hope that this brief talk has given you some ideas of some of the important work that NIDDK is involved in furthering kidney disease research. Thank you again for the opportunity to present and share this information at the AAKP Global Summit. And for those of you who'd like additional information, please visit our website at niddk.nih.gov, or you can follow us on Twitter and on Facebook at NIDDK.gov for more frequent updates on opportunities and available information related to these and other research activities under NIDDK's mission. Thanks again, and thanks again for this important invitation to speak to you.
Dr. Rodgers, I want to thank you for that presentation. On behalf of myself, Dr. Raj, and Paul Conway, we appreciate you spending the time with us and sharing that knowledge. And we're very excited because we think that you have set a tremendous pace for the rest of our global summit. Thank you very much. And we look forward to a continued relationship with NIDDK and the patient community represented by AAKP.